Hi, this is Dr. Emilio Justo from the Arizona Eye Institute and Cosmetic Laser Center, and welcome. Today we're going to talk a little bit about the difference in brow lifting techniques. There is a direct brow lift and an endoscopic brow lift, and those are the two that we're going to discuss right now. There is a third technique called a coronal brow lift, but I generally do not advocate that. So let's first talk about a direct brow lift and what the advantages and disadvantages are compared to an endoscopic brow lift. With a direct brow lift, the incision, as the name implies, is directly above the brow. And if I can just point with my finger, it goes from the inner corner of the brow to the outer corner of the brow. And similar to an eyelid surgery known as blepharoplasty, in a direct brow lift, the incision is above the brow and we're removing skin so as to pull up the brow, and then that incision is then sutured. So what are some of the advantages of a direct brow lift? Well, one big advantage is the direct brow lift can be done under local anesthesia, meaning that the patient does not have to be put to sleep. It's a relatively quick, painless procedure that takes approximately 35 to 40 minutes to do both brows. Now, another advantage is that a direct brow lift, in many cases, not universally, but in many cases, it can be considered a functional procedure. Functional meaning that it's a procedure that can be done under insurance for medical reasons. The reason that it oftentimes is considered medical is that it helps elevate the brows significantly enough that in many cases one can get it authorized by insurance. One of the big advantages of a direct brow lift is that it helps improve peripheral vision as well as improving eye fatigue and even brow strain in many patients. Now, what's the one big disadvantage to a direct brow lift? Well, as I described earlier, you have an incision directly above the brow hairs. You do not want to try and hide the incision within the brow hairs because that may kill off the hair follicles and that would give even a potentially worse look. But you do have an incision that is not hidden. This incision will gradually fade over the weeks and even over the months, but still an incision is still there and it will never fade to zero. Nonetheless, a direct brow lift is still commonly performed, and certainly those patients who are older or have more wrinkled foreheads are generally good candidates for that. Now let's compare a direct brow lift with an endoscopic brow lift. An endoscopic brow lift is a procedure that's always done under IV sedation. It takes approximately 1 hour, but it is a wonderful procedure, particularly for women, although men can have it as well. But one important concept is that an endoscopic brow lift is considered a cosmetic procedure. Unlike a direct brow lift, which I mentioned earlier, is oftentimes functional or medical, an endoscopic brow lift is always cosmetic. In an endoscopic brow lift, really one isn't doing it for medical purposes. The amount of lift is actually small, but it gives a very rejuvenated and youthful appearance, which again, in particular, women really love. Now, the reason it's called endoscopic is because we're using a fiber optic endoscope to visualize what we're doing. So basically there are minimal small incisions, and there's 5 of them. There's 1 behind each temple and then 3 up by the hairline. These 5 incisions are entry points for our surgical instrumentation, and an endoscopic brow lift is a two-handed technique whereby one hand is holding the endoscope, which is basically an instrument that has a TV camera at the end with a light source. And then the second hand is using the surgical instrumentation to do the dissection. Then with this TV camera, one can visualize what one is doing under high magnification projected onto a large screen TV in the operating room. Now, these incisions are much more hidden because they are at or behind the hairline The incisions fade very, very nicely, and very, very difficult to find these incisions after several weeks or several months. Now, with an endoscopic brow lift, the big advantage is that it really creates a much more rejuvenated and youthful appearance, in particular, as I mentioned earlier, in women. Brow lifts, whether they be direct brow lifts or endoscopic brow lifts, are also known as forehead lifts. So when you hear that terminology, please don't get confused. A brow lift and a forehead lift are the same thing. Direct brow lifts are done equally with men and women in my experience. However, in my experience, endoscopic brow lifts are done primarily in women. I hope that this short video has been useful for you and has answered many of your questions. I greatly look forward to meeting you personally and discussing this more in depth. Thanks for your attention.